What's up everyone? My name is Daan de Vries and I am a medical doctor from the Netherlands and a certified psychedelic therapist. Today we'll get into another challenge that people face when taking a psychedelic. And this challenge, in my opinion, is discussed far too little. And it is the non-experience. That moment when you have done your preparation, you're ready, you take the medicine and nothing happens. No visuals, no insights, no emotional release, just nothing. Understandably, this can be incredibly frustrating because you came ready for a transformation, right? And all you get is nothing? So why would this happen? And is there anything that we can learn from it? Let's get into what in my view are the three main causes, and I'll illustrate each and one of those with a case example. The first cause is biological or pharmacological. For a psychedelic to work, it needs to bind to specific receptors in the brain. And for the classical psychedelics, like psilocybin, this is mainly a specific serotonin receptor called the 5-HT2A receptor. Now, if those receptors are blocked, less responsive, already occupied, or just not expressed sufficiently, the experience simply won't get off the ground. For example, there's a small group of people that are just naturally less sensitive to psychedelics, and this is probably genetic. You'll hear them say things like, oh, I always need at least 5 grams of mushrooms or 300 micrograms of LSD to have a proper psychedelic effect. Now, those are heroic dosages for most people, but for some people, that's just what it takes. And that's totally okay. If we know about that, we can correct for it by adjusting the dose. Then, what's really much more common are interactions with medication and other substances. People that are on antidepressants, for example, often have a reduced psychedelic effect. And this reduced effect can remain for quite some time even after you have stopped taking the antidepressant medication. And there are many other medications and supplements that can dull or even completely block the experience. Let me give you an example. Some time ago we worked with a client from Switzerland. A lovely guy, really successful but also troubled. So he contacted us to do some psychedelic therapy, which we can do in the Netherlands with magic truffles that are legally available. We screened him, he had no contraindications, and he said he used no medication. Now he received, in several steps, what I would consider a very high dose of psilocybin, and yet almost nothing happened. Now, as you can imagine, this was really frustrating, both for the client but also for us, the therapists. Later, we discovered that he occasionally used a drug called olanzapine to help him sleep. And he had taken it a few days before the experience. And since he only took this very occasionally, he didn't think it was relevant enough to mention it during the screening process. But olanzapine is a drug that stays in the body for a really long time. It has a half-life of about 30 hours. And it blocks the exact same receptor that psilocybin needs to bind to. So in this case, the medicine literally couldn't get to the receptor it needed to activate. So that's the first and probably most important reason. Sometimes, purely on a biological or pharmacological level, something gets in the way of the psychedelic effect. The second reason is psychological resistance. This was already recognized decades ago by one of the pioneers of psychedelic therapy, Stan Grof. And Stan Grof is truly one of my heroes. He treated thousands of people with LSD in the 1950s and 1960s, and he has written multiple books about it. For example, in his classic book, LSD Psychotherapy, he writes, people who in everyday life have a strong need for control and find it hard to let go could often resist very high dosages of LSD and show no detectable change. Among psychiatric patients, he found that those with obsessive-compulsive traits were particularly resistant, often resisting heroic dosages for multiple sessions before they started getting a psychedelic effect. On the same page of the book, page 53, he even reports giving a patient 15,000 micrograms of LSD by injection in the muscle without producing a psychedelic experience. And then he just continues the paragraph like it's the most normal thing in the world. I mean, what the f***, Stan Grof? You are a real hero of mine, but I would love to know the clinical reasoning that went behind this decision. It was the 1960s, I guess. What can you say? Still, his point was clear. Psychological resistance can be incredibly powerful and it can completely block the psychedelic experience. And it can't just be overcome by increasing the dose. A recent example from our practice, a woman in her early 50s came to one of our retreats. Awesome woman with a real no-nonsense mentality. really the kind of person that always keeps it together. But by always pushing away all of her negative emotions, she also lost her capacity to experience the positive. During her first psilocybin journey, nothing happened, just some mild dizziness and a lot of frustration. And even during the second journey, it took a long time before anything began to shift. But when it finally did, about 2.5 hours into the second journey, it hit with full force. And it was deeply emotional and profoundly healing, because she finally allowed herself to fully let go. So that's psychological resistance in action. And it's not something you can just push through. It's really something that has to soften over time with safety, trust, and surrender. The third one is when experiencing nothing is the lesson. Let me tell you a story. Several years ago, I got my hands on some mescaline. I took it with my girlfriend. She took around 200 milligrams and had a fantastic experience. Beautiful visuals, really deep sense of connection, and just feeling wonderful. I took a lot more, around 500 milligram, and absolutely nothing happened. So naturally, I thought, well, let's take some more. Which turned out to be not a good idea, because what followed was a very challenging experience. I entered a state of pure emptiness and boredom. No visuals, no insight, no emotion, just the most profound boredom that you can imagine. And on top of that, my sense of time completely broke down. So every minute felt like hours, and every time I checked the clock, it had barely moved at all. I spent around 8 to 10 hours in that state, which honestly felt like several years of solitary confinement. Now, at the time, I didn't understand it, but afterwards I realized that boredom was the experience. As someone with ADHD, boredom has always been one of my great enemies. And because I'm not good at just sitting with it, I permanently find ways to distract myself. Well, on that night, I just had to sit with it, right? With no distractions, no escape, and no stimulation. And you learn something in that kind of time. So now, even years later, whenever I catch myself wanting to go for some dumb distraction, I remember that night. And I realize that I can actually just sit with the boredom. So even though I would never want to go through that experience again, it did turn out to be incredibly helpful for me. So why would a non-experience like that happen? Well, here we are going to get into something that science doesn't yet fully explain. And that something is often called the inner healing intelligence. And you could see it as that something that's inside of you, inside every one of us, that is infinitely more intelligent than your rational mind. It's the same life force that beats your heart, digests your food, and repairs your body while you sleep, without you having to decide how to do it. Now, sometimes that inner healing intelligence decides that you do not need more visions, more insight, or more psychedelic medicine. Maybe what you really need is some silence. Or maybe your body just needs some rest. Or maybe you already know what you need to do. So that's the third reason. Sometimes the medicine's message is found in the silence, telling you you don't need to go anywhere else because you are already there. Alright, that's it. Those are, in my experience, the 3 main reasons for a psychedelic non-experience. So if it ever happens to you, you can use this framework to help you analyze what could be the cause. Just a quick recap. Sometimes it's biological, which means something got in the way of receptor activation. Other times it's psychological, which is very often subconscious resistance or fear of what might come up. And sometimes experiencing nothing is the lesson. If you're working with a skilled facilitator, they can help you prepare for and minimize the chances of such a non-experience. But even then, it can still happen. And that's really okay, because if it does, it is not a failure. It's really part of the process. And very often, it opens the door for something deeper next time. Thanks for watching, and I would love to hear from you. Have you ever had a non-experience? And which of these 3 causes do you think was at play? If you found this helpful, please subscribe or share it with somebody that might benefit. Peace, and see you next time.